Hello, I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Michael Liu, Professor and Senior Associate Dean of Public Health at George Washington University. Welcome, Dr. Liu.
Thank you for having me.
So we heard today about the issue of maternal mortality in the United States, and many people may think of this as an issue from a bygone era, but how large is this problem in the United States?
Yeah, I think a lot of people don't know about this, that every year in the United States, more than 700 women die from complications during pregnancy and childbirth. I think that's 700 too many. And more than 50,000 women suffer a life-threatening complications, or what we call severe maternal morbidity. We are the richest nation on earth, and yet we now rank dead last amongst developed nations on maternal mortality. I think this is a national disgrace. I think we can do better as a nation.
So those numbers, I think, should shock people. But how confident are we in the accuracy of those numbers, and is that part of the problem?
It is part of the problem. I think we're getting better, but I think there's still a lot more work to do. So when it comes to counting maternal deaths, there are basically several ways, 3 ways that we could do this. There's the maternal mortality ratio, which is, captures deaths up to 42 days after pregnancy, and it's based on a pregnancy checkbox on the death certificate, which could lead to a lot of false positives and false negatives. And because of that, the CDC developed the PMSS that Dr. Callahan talked about earlier today, and that's the pregnancy-related mortality rate. And that, I think, improves upon the maternal mortality ratio. It has more information, and it goes up to 1 year after the end of pregnancy. But it still has its limitation because it's still vastly based on vital statistics. And that's why I think what CDC and others are doing right now, working with the states to really promote maternal mortality review that really dives deep into the clinical causes of maternal death. I think that's critically important because if we want to know how to prevent maternal mortality, we really need good data about causes, about prevention, and about whether what we're doing is working or not.
So, Dr. Ollier today spoke at some length about maternal mortality review committees in states or in hospitals. It's a kind of bureaucratic sounding name, but what do they do and how can they help prevent maternal deaths?
Well, I think these maternal mortality committees do such important work in terms of looking at every maternal death and try to figure out what could have caused it and whether the death could have been prevented. And that information goes a long way in terms of helping us bring about either practice change or policy change that could potentially avert another death.
So one of the information that can be gleaned from that is what proportion of deaths might be preventable and what are, in fact, the leading causes of death, from regardless of what data source. What kind of information do we know about that?
Well, we do know that the leading causes of maternal deaths are hemorrhage, preeclampsia or toxemia, and embolism. But we also know that cardiovascular diseases, including postpartum cardiomyopathy, are becoming increasingly important causes of maternal death. Statistics vary, but a number of studies shown that more than half of these maternal deaths are preventable.
Now, as we are facing an older population, but also even in our younger population, an increasing burden of chronic diseases, does that have an impact on maternal mortality? And are there steps we could take to impact that?
Absolutely. So we know that the demographics of childbearing is changing in the United States. Women are older when they get pregnant. Women are also entering pregnancy with more chronic conditions like hypertension, diabetes, heart disease, as well as obesity, which are major risk factors for maternal mortality and severe maternal morbidity. So I think if we really want to move the needle on maternal mortality in this country, there are two things that we have to do. We have to improve women's health before they get pregnant, and we have to improve the quality and safety of maternity care in this country.
Okay. So related to that second issue, the quality and safety of maternity care, Dr. Ollier introduced us to the concept of a safety bundle, and some of our audience may have heard that in other public health contexts. What is a safety bundle? What's an example of one? And how does that help save a life in the hospital context?
So a safety bundle are best practices or other resources, including toolkits, that's all bundled up to really improve the quality and safety of maternity care. A number of these safety bundles have been developed over the last few years to address some of the most common causes of maternal death, including hemorrhage, thromboembolism, as well as preeclampsia. And a number of other bundles are under development, including one for cardiovascular diseases, as well as opioid misuse during pregnancy. And I think these bundles really get at the 4 R's. Readiness, you want to be ready before a complication occurs. Recognition, you want to be able to recognize when the complication's happening really early on, because the longer the delay, the worse the outcome. You want to be able to respond in the most effective way. And then most importantly, you also want to be able to kind of report back and then really learn from this experience so that you can continue to drive improvement in your clinical practice. So I think these bundles really help support clinicians and hospitals to improve the quality and safety of their care through the 4 R's.
Okay. So, Dr. Liu, you're trained as an OBGYN. You have a long career as a senior leader in maternal and child health. I'd like to ask you to reflect on kind of your personal perspective on maternal mortality. What issues does it raise for you?
Well, I think that we have come such a long way. We have such a great momentum going on right now in maternal mortality. This problem's been going on for decades. I remember reading about the problem of maternal mortality in the United States when I was in medical school, and the problem just seems to get worse and worse, and to a point where there was one point maybe we thought that there's nothing that we could really do about maternal mortality. I think the experience that I had in California can really change my view about this. That in California, I saw a network of doctors, nurses, public health professionals that was trying to spread quality and safety across all the hospitals in California by implementing these early versions of these safety bundles. And they just went door to door. They provided in-service for labor and delivery staff. They did ground rounds. They engaged hospital CEOs and OB chairs, and they started to change practice and policies hospital by hospital. And then when you look at the data in California, up until about 2006, California was trending with the rest of the United States. The maternal mortality rate just kept going up. But between 2006 and 2012, maternal mortality decreased by more than half. and in just 6 years. And that's with the implementation of the safety bundles. So that's what I think that if we could replicate the success in California throughout the rest of the United States, and that's really the genesis of the AIM project that was mentioned earlier today. I think we could really move the needle over the next few years on maternal mortality in this country.
Thank you very much, Dr. Liu, and thank you for ending on that optimistic note.
Thank you, John.
Please join us next month for Beyond the Data.